Do your shoulders hurt? Have you been told it's your upper trapezius? Well, it could be something else. Keep watching to find out. What's up everyone, this is Dr. David Song from Rehab Hero, and today we'll be talking about an elevated first rib as an uncommon cause of persistent shoulder and neck pain. So what is an elevated first rib? Well, it's just what it sounds like. Up here we have your first rib, and most people don't actually realize that it does go above your collarbone here, otherwise known as a clavicle. And it can be an area of contention where the joint itself can start referring pain to the shoulder area. But a lot of time people believe that it's just an upper trapezius that's super tight and tender because the upper trapezius goes on top of it. However, if you find that the pain is not being addressed or going away successfully with massage techniques, strengthening exercises, then it could actually be due to the first rib. So why does this happen? This basically happens when there's a slight superior translation, which means upward translation of the first rib relative to the T1 vertebra. And this will be at the costal transverse and costal vertebral joints of that joint. So this is actually forming two joints here, even though it just looks like one. Just to be clear, this isn't that the joint is out of place or anything, but the joint could be experiencing restricted movement, which can cause some discomfort when you need to do things like working at your desk or any other type of athletic activity. This rib can get elevated if the muscles that attach onto this first rib are tight and tender. So which muscles are we referring to? We're mostly referring to your scalene muscles, specifically your anterior and middle scalenes, as they attach from the cervical spine onto the first rib. Your posterior scalenes, which can be involved, really attached to your second rib, and that sometimes can be involved with this. The scalene muscles are actually accessory muscles for breathing, and they function as very light movers of the cervical spine. They go from the cervical vertebrae and attach right onto these scalenes, and when they're really tight, they can actually cause other conditions like brachial plexopathy, which can lead to numbness or tingling down the shoulder and arm, even into the hand. But today we're not going to go into that condition. We're going to be focusing mostly on the elevated first rib. So what does an elevated first rib feel like? It can feel like a lot of stiffness, a lot of achiness. That's kind of globally generalized in the shoulder region. The reason why is the generalized pain versus a specific pain is because a lot of the pain is generated from the joint itself. Joint pain tends to be non-specific, which means that it tends to just refer pain in a general area, and it's very hard to pinpoint exactly where it's coming from. Like I said earlier, if you find that massage doesn't really help, this can be self-massage using a massage ball, or it could be a professional massage done by a licensed massage therapist. That's an indicator that the joint itself is being problematic, because you can't successfully massage out a joint because it has to do with two bony surfaces. It has nothing to do with the soft tissues itself. So today we're going to also be going over what you can do to mobilize the joint itself. Joints recover well when it comes to exposed movement. So like I said, this is a restricted joint at the T1 costal vertebral joint or costal transverse joint. So all we want to do is introduce some movement. We're not really trying to realign it or anything like that, because the joint itself is not out of alignment. It just needs some love. Typically when you're experiencing an elevated first rib, it can take anywhere between 3 to 6 weeks for it to improve, and that's with consistent exercise that is dedicated to mobilizing this joint. In some circumstances, if you're not getting treated or you're not doing any exercises for it, it can last a little bit longer. I've had patients had this for over 3 months before they started to get it worked on, and then it would get resolved within the next month and a half. So we'll be breaking up the 6-week program into 2 weeks each, so 3 different phases, with the first phase focusing on how you can start to passively introduce some movement back into this joint. Phase 2 is about gaining some active mobility, and phase 3 will be introducing some strengthening exercises so you can utilize the muscles surrounding the joint all together with the joint itself. So let's get to the phase 1 exercises. So one of the exercises that we'll be doing during this phase 1 is a self-massage of the scalene muscles. So like I said, a very tight or tender scalenes muscle can cause elevation of this first rib as they anchor onto the rib from over top of it, so it can effectively pull that rib up. We're gonna do a gentle massage along the front of your neck because you have a lot of sensitive structures there, including your nerves and blood vessels. So we're not gonna press too deeply, we're just going to do enough to get a bit of a massage. To find the muscles, you'll first find 3 ropey structures, which are going to be your scalenes along the front of your neck. Just using the pad of your fingertips, you're just going to go and feel for these 3 ropey structures. They're going to kind of feel like guitar strings under your skin if they're really tight, or almost like an uncooked spaghetti noodle. So they'll be kind of going from diagonally from your neck down to your shoulder, right in the middle of this triangular space formed by the upper trapezius, your neck and your clavicle. So it's going to be somewhere right in the middle. Just to help you find it, I'll put up a photo up here so you can see what it looks like from an anatomical model perspective. Once you find these three muscles, we'll be targeting the two that are the furthest forward. Okay, so you're going to find 1, 2, 3. The third one is going to be the most back. We're going to ignore that one for the sake of this video. Once you find it, you're going to take a massage ball and you're going to lightly compress it into that muscle. And you're going to take your opposite hand and you're just going to put some pressure inwards towards your neck. So you're not just pushing backwards, you're not pushing inwards, you're kind of going on an angle into your body. From here, once you kind of find it, you might feel some referral pain down the arm. If it's a little bit, that's okay. We're really not trying to go above a 4 or 5 intensity with this type of massage. So if you do feel more pain than that, just lighten up how hard you're pressing into the ball. Once you feel this pressure, all you're going to do is bend your neck to the opposite side just to get a soft stretch into there as well. You're gonna hold this for up to 30 seconds or until the tenderness kind of disappears, and then you're going to back off. You're going to find the other muscle by just rolling the ball slightly back and then repeating once again. We're only going to be doing 2 spots, 30-second holds each, and then we're going to move on to our next exercise. When it comes to self-massage exercises, it's really important to realize that less is more. This means that you do not want to be hammering away at this muscle a lot. Okay, so you're not doing this more than once a day, and you're not going to be doing it more than 3 times a week, which really means you're only going to be massaging it out once every 2 days. The problem with doing a little bit more than that is that you're going to be overworking the tissue and potentially even bruise the structures that you're working on. And this will just delay your recovery. It's really also important to realize that the best benefits or the best results come from the recovery period, not from the actual massaging process. So it's once you massage everything out, the 2 days rest that you give your body for that muscle to recover, that's when things start to get better and healthier. All right, so let's move on to our next exercise in the phase 1. The next exercise that we'll be doing requires a monster band or a pull-up assist band. I'm using the green one. You can find these online if you don't already have one. Sometimes your local gym will also have them as well. What we're going to do is we're going to first take the band and we're going to place it right along over top our shoulder, kind of towards the base of your neck. So right where my neck ends, that's where I want the band to be. From here, I'm going to take the other end, I'm going to step on it with my foot, and what this will do is anchor down that first rib of mine. So you can either step it on the same leg or you could go across the body and step it with the other leg. It really depends on which one feels best for you. Personally, I like the angle that the cross body presents, but everyone's a little different. So what it's going to be doing is helping to pull that rib down, because the problem tends to be that the ribs are elevated. So we're going to depress it with the help of the band. And from here, we're going to do very light head tilts in the opposite direction. And I say light because we don't want to be overstraining the scalenes muscles by putting them into a deep stretch. They're very thin, very small muscles, and we don't want to be overworking them, especially at this stage of your healing process. So I'm just going to be doing a nice little head tilt. You might find, depending on how tight your scalene muscles are, that you might not get much movement at all before you feel a medium to light stretch. For me, because I have healthy scalene muscles, I can get pretty close to a 45-degree angle or bend before I feel a light to medium stretch. And once you get to that stretch, you're only going to hold it for 1 or 2 seconds, and then you're going to come back up to a neutral position. And this is because we're not really focusing on trying to stretch out the scalenes so much as we are just trying to mobilize the joint through this side bending motion. For this exercise, you can do anywhere between 10 to 20 repetitions depending on how it feels. And you should find that as you continue to do this movement, it does loosen up. You could get a little bit further, your range of motion increases before you feel that light stretch again. You could rest for 30 seconds to a minute before doing another set, or you can kind of do this exercise twice in the day, so once in the morning, once at night. This exercise, unlike the massage exercise that we did earlier, can be done daily. You can do up to 20 to 40 repetitions based on how it feels. It's really important that you're not pushing into pain. If you get symptoms like numbness or tingly down the arm, if you get any headache referral, or if you get any pain into the shoulder blade, you want to just take a brief break, maybe call it a day with just that, and then see how much you can do tomorrow instead. All right, so we just completed phase 1, which had to do with increasing passive mobility, or passive flexibility, I should say. Is about using external tools to help push us into ranges of motions that we didn't previously have. Now we're going to go into phase 2 recovery exercises, which is about active mobility. Active mobility is about trying to get these joints to move without any external help and trying to do it ourselves. For this next phase, the exercises can also still be done daily, like the stretch that we just finished. Let's get started. The first exercise that we'll be doing in the phase 2 recovery is called an overhead shrug neck rotation. And it's a very easy exercise to do, and you can do this exercise daily. So first you're going to do is have your hands up in the air, and from here you're going to shrug your shoulders as much as possible. Now, the problem is a lot of people, when I see them in person, they think they're shrugging high enough. Try to shrug even more than you even think, okay? So you really want to try to get the shoulders to touch your ears while you're doing this exercise, and you get pretty high up there. Once you get to this position, all you're going to do is rotate your head, and you're going to rotate fully one direction and then the other. So from here, I'm going to keep my shoulders shrugged, I'm going to rotate my head all the way to my left, and then I'm going to rotate all the way to the right, and then back forwards, and then from here I'm going to actively drop my shoulders down. So what we're trying to encourage is activation or an elevation and depression of this first rib while we're using our scalenes muscles to just rotate our head. Okay, so we're going to do that one more time. You will of course feel your upper trapezius, your levator scapulae, your SCM. You'll feel other muscles activate, and that's a-okay. It's not about pinpointing a certain muscle, it's about just getting the movement done. So from here, once again, we're going to elevate our shoulder as far as possible. I'm going to rotate my head all the way one way. And it's really important that as you're doing this exercise, you're not letting your shoulders drift down, okay? You got to continue to reach as far as you can. Back forwards, rest. We're just going to do one more. Reaching up, you can alternate which side you start with as well. So I'm going to look to my right first, then look to my left, then back forwards and back down. Now this exercise is a pretty high activation of those shoulder and neck muscles. You don't need to really push through pain if you're experiencing any. Just do as many reps as you can without it hurting. Generally speaking, I like to get my patients to do anywhere between 6 to 8 repetitions, and they'll do about 2 to 3 sets back to back, with about 30 to 60 seconds of rest in between each set. So you could do this right after the phase 1 exercises. You don't have to ditch phase 1, even though we're in phase 2 right now. Sometimes it's really good to warm up with the phase 1 exercises and then go right into the phase 2 exercises. Next, we're going to be doing another exercise called the Gittleson shrug. For the Gittleson shrug, this exercise is to be done anywhere between 8 to 10 repetitions, or as you can tolerate. If it hurts too much while you're doing it, just back off, and it's okay to rest before you do a few more for your next set. Even though I said the aim is to do 8 to 10 repetitions, it doesn't mean you have to complete 8 to 10 repetitions. If you can only tolerate 4 repetitions, you're only doing 4, and that's okay. That's who you are today. You might be able to do a little bit more tomorrow. Likewise, if you find that you can do more than 10 repetitions, just go for it. There's no hard guideline as to how many repetitions you have to do. It really just depends on how you're feeling today. That being said, you're going to be resting anywhere between 30 to 60 seconds in between sets, and you can do anywhere between 2 to 3 sets a day of this exercise. So to get started, we don't need any equipment at all. All we're going to be using is our body. First thing you're going to do is just have your hands by your side. They could be in any position other than that. From here, you're going to just shrug up the side that's affected. And while you're shrugging that up, you're also going to laterally bend your head and neck to the same side. So basically, you're just trying to get your ear to touch your shoulder with this exercise. You're going to go all the way, hold it for a brief 1-2 seconds, and then you're just going to come back down. When you come back down, just return back to your shoulder neutral position. Try to get the shoulder drop down towards the floor so you're working the full range, and then you're just going to be doing it again. And that pretty much sums up this exercise. Up next, we're going to be doing our phase 3, which is really about introducing some strengthening exercises into your recovery process, just because this issue does have to do with your muscles, even though it's not directly related to your muscles. All right, let's get started. The main exercise that we'll be doing in this phase 3 is a modified Lou raise. We're modifying the Lou raise to emphasize the shrugging component of this exercise as well as the depression component of this exercise. So we're going to be starting with 2 dumbbells. You're just going to hold a weight that you can manage. We really can scale up after, but really day 1, you just want to see if you can complete the movement pain-free. From here, you're going to be completing a lateral raise, a standard lateral raise, and it's really important that while you're doing this, your hands aren't completely next to you. They're actually about 15 to 30 degrees in front of you. So you should be able to see your hands within your peripheral vision, just right at the edges here. As you're doing that lateral raise, right about at 90 degrees, you're just going to do a rotation in your hand so that your palms are facing forwards, and you're going to start shrugging your shoulders up as you're raising the weight. So right here, I'm going to go directly overhead. And at this point, I'm trying to reach the ceiling as high as possible. From there, I'm just going to come back down. You don't need to hold that part, and you're just going to reverse the motion. So as soon as you hit about 90 degrees, palms go down towards the floor and you're lowering back down. For this exercise, we'll be doing anywhere between 10 to 12 repetitions. We're not really trying to hit failure with this exercise because it's more so about activating these muscles than we are trying to hypertrophy them. You'll be doing anywhere between 2 to 3 sets, and we're moving away from the daily exercise program. We're going to be doing this exercise 2 to 3 times a week. We're going to be making sure that we have at least 1 day of rest between each exercise session so that you could give your muscles sufficient rest now that we're starting to load them up. The last exercise that we'll be doing for the phase 3 is your standard farmer's carry, or also known as your suitcase carry. And it's a suitcase carry because we're only going to be holding one weight on the affected side. For the consistency of this video, I'm going to just do it on the one side that we've been targeting the whole time, which is my left side. So you're going to hold a kettlebell that you find is about a medium weight difficulty for you. I don't want you to go into the heavy weight difficulty because that will kind of change the goal of the exercise. Right now, we're just trying to basically get your muscles used to stabilizing a depressed shoulder. And what this will do is help to get the muscles conditioned to contracting in a lengthened or stretched position. So it's one thing to be short and strong, but now we want to be long and strong, okay? So I'm going to hold a kettlebell. This one's about 18 pounds, so it's not a weight that I have a large amount of difficulty with. And from here, I'm just going to make sure my arm is depressed. So I'm letting this pull my shoulder down completely. And I want these muscles to kind of allow for that stretch. So I want to make sure I'm not shrugging up to hold it in place. I'm just holding nice and tall. From here, I want to also make sure that my neck is relatively neutral. So it doesn't have to be perfectly straight up. I just don't want it to be bending one side or the other because I'm just having such a hard time holding that weight up. I want to make sure I can stabilize this movement. From here, you'll just do a bit of a walk. So we're going to be doing about 100-meter walk, and you could do this just around your house. Just go down the hallway, and after about 100 meters, you could rest for about 30 to 60 seconds by just dropping the weight and then doing anywhere between 2 to 3 sets. You could just also go outside and do this on the sidewalk, and it doesn't have to be with a kettlebell. You can use any dumbbell or even just a jug of water or a bag of groceries or something like that, as long as it's a weight that you can comfortably tolerate without overstressing your system. All right, that sums up our video for an elevated first rib, which again can be one of the uncommon causes for persistent shoulder pain. If these exercises helped you, please let me know in the comments below and share the love with other watchers so that they can also benefit from this video. If you have any questions, let me know in the comments below. And if you haven't hit subscribe, please do so. Every subscribe helps to support the channel so much. If you haven't already gone assessed, we do have 2 clinics in the GTA region. If you don't have access to our clinics, it's highly recommended that you see a healthcare professional near you so that you can make sure that these exercises are at least going to be effective and you're not wasting your time. Thanks everyone for watching. I'll see you all next time. Peace.